Welcome to our lesson on processing baby pigs. Once baby pigs have had a belly full of colostrum, you can begin processing litters. Your farm may do this anytime within the first 3 days of life, and it will be one of the first major interactions you will have with the baby pigs, besides monitoring sows as a farrow. By processing within the first 3 days of life, you are ensuring ample time for the piglets to heal completely before weaning. Processing is stressful and can be painful. To minimize stress and the pain of castration and tail docking, it is important that you use sharp, functional equipment and complete processing as early in life as possible. Step 1, be prepared. Prepare your processing equipment and be sure it is clean, disinfected, dry, and working properly. Every country will have their own set of standards. For example, in the United States, the common swine industry audits instructional tool states clean, sharp equipment must be used to minimize pain and risk of infection. Some of the things done during processing can be painful, and keeping this equipment in good working condition can ensure this process is done well. Step 2, safely pick up the pig. When you safely pick up a pig, you can use one of two techniques. 1, grab the hind legs of the pig and lift straight up. Or 2, lift the pig by supporting it under its belly. When you set the pig down, make sure both of the pig's front legs are touching the ground. Then release the pig's hind legs to the ground. Never throw or drop a baby pig. Step 3, trim the umbilical cord. The cord should be trimmed to about 1 inch in length, that's about 2.5 centimeters. Use scissors or side cutters and spray the umbilical stump with disinfectant spray after cutting. The cord should only be trimmed with utensils if it is dry. If the cord is still wet and long, use your fingers to fray the wet cord like so. Use tension to snap the veins and arteries in a way that they will close up when they retract. Place the scissors or side cutters in a properly diluted solution of disinfectant in between each piglet. Step 4, dock the tail. Whether you tail dock depends on what country you live in. For example, tail docking is common in the United States and not allowed in other countries. In the United States, the common swine industry audits instructional tool states tail docking is performed to reduce tail biting and cannibalism among pigs. Tail docking should be performed early and sufficiently prior to weaning, such that no open wounds remain at the time of weaning. Clean, sharp equipment must be used to minimize pain and risk of infection. Be sure your farm is adhering to your country's standards. A properly docked tail should be about 1/4 inch in length. This is about 1 centimeter or less. Use a cauterizing tail docker and/or sharp, clean clippers and spray the tail with disinfectant after cutting. Look for this point on the tail where it naturally begins to shorten. This is a good visual guideline for tail docking. Realize the tails on replacement gelts should be long enough to touch the tip of the vulva. If a boar is going to be kept for heat checking, leave the tail on. I want you to understand why tail docking is considered important in some countries. Look at this. This is what tail biting looks like in finishers. It looks pretty painful, doesn't it? But even worse, this is an infection that can proceed up the pig's spine and cause this pig to die. And that is why we tail dock. Step 5, check for scrotal hernias. A scrotal hernia is when part of the gut protrudes through the inguinal canal into the scrotal sac. If you castrate a pig with a scrotal hernia, there is a risk of the intestine exiting the body through the castration incision. This is why you need to check for a scrotal hernia before castrating. Take a look at this pig. He has a scrotal hernia. You can see the bulge of intestines protruding into the scrotum. This pig will need to be castrated using a technique learned in our lesson, scrotal hernia repair. Step 6. Castrate the male pig. Whether you castrate depends on what country you live in. For example, castration is common in the United States and is not allowed in other countries. Immunological castration is an alternative technology that prevents boar taint. If you are outside of the United States, follow your country's protocol. The U.S. Common Industry Audit's instructional tool states castration of male pigs is performed to reduce aggressive behaviors and improve the palatability of pork. The American Association of Swine Veterinarians supports the use of procedures that reduce pain, including the development and approval of practical analgesic and anesthetic protocols that improve piglet outcomes. Currently, U.S. commercial market pig processors do not accept uncastrated male pigs for sale into the domestic or foreign food supply. Surgical castration should be performed early and sufficiently prior to weaning, such that no open wounds remain at the time of weaning. Clean, sharp equipment must be used to minimize pain and risk of infection. First, push the testicles up. Next, make an incision over each testicle using a sharp, clean scalpel. Always cut away from yourself. Push out the testicles. Pull the testicles straight out and cut the cord as close to the pig's body as possible. Some farms will have you pull the testicles straight out without cutting. If you do so, pull parallel to the pig's body and never at an angle. Spray the scrotum with disinfectant spray. Change your scalpel blades frequently. Some farms will want you to change the blades between each litter. Realize you should remove 2 testicles from the male. If only one is available, it may be possible he has a retained testicle. A ear tag should be placed in the ear of any pig that has a retained testicle. And in the wean-to-market barns, people can give special attention to pigs with these tags because later on in that pig's life, the testicle will typically drop. Look for that dropped testicle and castrate it as needed. For the United States, the Common Swine Industry Audit's instructional tool states that if surgical castration is performed after weaning, analgesia, that's pain control, and/or Amduca permissible anesthetic, that's anesthetic recommended by your veterinarian when they're following this legislation, should be used. Step 7. Administer iron, medication, and any vaccines. Follow your farm's processing plan for specific timing and dosages. You'll need to change needles every litter or every 10 to 15 pigs, whichever is less. See our lessons on giving a baby pig an injection and on giving a baby pig a vaccination. Step 8. Clip teeth only when necessary. If baby pigs have scarred faces or the sow has a red or painful udder, trim the teeth of every pig in the litter. Using the designated side cutters, cut half of the tooth away. Take a look at this tooth. So you're going to cut the tooth right at about this level here. Make sure to create a flat, not angled surface on the tooth and repeat the process for all 8 needle teeth. Take care not to cut the gums, lips, or tongue. Place the side cutters in a properly diluted solution of disinfectant after each litter. Do not use the solution you used for disinfecting your tail docking equipment. At one point in time, the industry used to clip all baby pigs' teeth at birth, but that is no longer the standard. We now know teeth clipping is unnecessary except in litters where pigs are fighting or the sow's udder is scarred or injured. Thanks for joining us for this lesson on piglet processing. See you next time.